The hidden warnings your heart sends before a crisis. When you think of a heart attack, what's the first image that comes to mind? A dramatic collapse, a sharp pain in the chest, someone clutching their arm in agony. That's what Hollywood has taught us. But real life is different. What if I told you that many heart attacks don't start with chest pain at all? Instead, they begin with subtle, almost invisible warnings. Symptoms that most people dismiss until it's too late. And here's the scariest part. By the time the classic signs show up, the damage may already be done. You might be thinking, I feel fine, I exercise, I eat well. This doesn't apply to me. But heart disease doesn't just target the elderly or those with unhealthy lifestyles. It's the world's leading cause of death, and it can strike anyone at any time. That's why in this video, we're breaking down 9 overlooked warning signs that your heart may be in trouble. Some of these will surprise you, but recognizing them early could mean the difference between a life-saving intervention or a life-threatening emergency. Stay with me, because by the end of this video, you'll know exactly what to look for and what to do next. Let's start with the first symptom. And trust me, it's something you'd never expect to be connected to your heart. The 9 hidden symptoms you can't afford to ignore. Here's something most people don't realize. Heart attacks don't always come with a dramatic chest pain. In fact, many start with symptoms that seem completely unrelated to your heart. That's why so many people miss them. You might think, if it were serious, I'd feel something obvious, right? But that's exactly the problem. Heart disease develops silently, sometimes for years, with small warning signs that are easy to overlook. People mistake them for stress, exhaustion, or just getting older. But ignoring these symptoms is like driving with a flashing check engine light, hoping it'll go away. So, what are these early warning signs? What does your body do when your heart is struggling? Today, we're breaking down 9 symptoms that could mean your heart is in danger. Some might seem harmless, but recognizing them early could be the difference between preventing a heart attack or facing an emergency. And the first one? It doesn't start in your chest. It starts in your legs. Symptom number 1. Swelling in the calves. The silent warning in your legs. Have you ever noticed your calves feeling swollen, sore, or cramping? Especially after walking or standing for long periods? Most people chalk it up to dehydration, aging, or just overdoing it. But what if I told you this could be an early warning sign of a serious heart condition? This symptom could be linked to peripheral artery disease, PAD, a condition where plaque builds up in your arteries, restricting blood flow to your legs. Think of your blood vessels like highways. When traffic flows smoothly, everything works as it should. But when lanes start closing due to blockages, congestion builds, pressure increases, and suddenly your muscles aren't getting the oxygen they need. The result? Pain, swelling, and discomfort. But here's what most people don't realize. PAD isn't just a circulation issue. It's a major red flag for heart disease and strokes. If your leg arteries are clogged, it's highly likely that the arteries leading to your heart are too, and ignoring it could lead to heart attacks, blood clots, and even amputations in severe cases. The good news? You can take action now. Regular exercise, a heart-healthy diet, and quitting smoking can help keep your arteries clear and your heart strong. But if you've been experiencing persistent calf pain, swelling, or cramping, don't wait. Talk to your doctor. Catching this early could save your heart and your life. Now let's move on to symptom number 2, one that starts in your mouth but is deeply connected to your heart. Symptom: bleeding gums. What your gums are secretly telling you about your heart. A little bleeding when you brush or floss. No big deal, right? Maybe you think you just brushed too hard, or you've been slacking on flossing. But what if I told you your gums might be sending a distress signal from your heart? Bleeding gums, inflammation, and gum disease. also known as periodontitis, aren't just dental issues. They could be signs of chronic inflammation that's quietly damaging your heart. Here's why. When your gums are inflamed, harmful bacteria enter your bloodstream, triggering an inflammatory response that accelerates plaque buildup in your arteries. Over time, this increases your risk of heart disease, strokes, and even heart attacks. Think of your bloodstream like a highway. When bacteria from your mouth leak into your blood, it's like reckless drivers flooding the road, creating chaos and damage. They weaken artery walls, promote dangerous clots, and make it easier for blockages to form. And here's the shocking truth. Research shows that people with gum disease are significantly more likely to develop heart disease. So much so that some cardiologists now ask about oral health during heart screenings. So what can you do? Treat your oral health like heart health. Brush and floss daily. Not just for a clean smile, but to stop harmful bacteria before they enter your bloodstream. Get regular dental checkups. Gum disease is easier to treat in early stages before it escalates into a cardiovascular risk. Pay attention to your diet and stress levels, because inflammation affects more than just your mouth. If your gums bleed often, don't ignore it. It might seem small, but your heart could be listening. Now, let's move on to symptom number 3, something that happens while you sleep, but could be putting enormous strain on your heart. Snoring number 3. The silent nighttime threat that's strangling your heart. Loud, persistent snoring. It's often the subject of jokes, a frustration for partners, or just something you assume comes with age. But what if that snoring is actually your body's way of warning you about a serious heart problem? Sleep apnea is a condition where your airway becomes partially or fully blocked during sleep, causing repeated interruptions in breathing. And here's what most people don't realize. Every time your breathing stops, your heart is forced into overdrive. Imagine pinching a garden hose while the water is running. The pressure builds up behind the blockage, and when you release it, the water surges through forcefully. That's exactly what happens in your blood vessels when oxygen drops during sleep apnea. The heart has to work harder, blood pressure spikes, and over time, this increases the risk of high blood pressure, irregular heartbeats, heart disease, and even strokes. And the effects don't stop when you wake up. People with sleep apnea often feel exhausted, foggy-headed, and irritable, no matter how long they slept. Morning headaches, trouble concentrating, and even falling asleep during the day are all red flags. Yet many remain undiagnosed, thinking they just aren't getting good sleep. Here's the truth. Untreated sleep apnea can double your risk of heart disease. It puts constant stress on your heart, leading to long-term damage that could be avoided with early intervention. So what can you do? If you or someone you love snores loudly, wakes up gasping for air, or feels constantly exhausted, get evaluated by a sleep specialist. Treatments like CPAP machines, weight management, and lifestyle changes can dramatically improve sleep quality and reduce heart strain. Don't ignore what happens while you sleep, because your heart is paying the price. Now, let's move on to symptom number 4, one that might seem like just a bad day, but could actually be your body's distress signal for an emergency. Symptom number 4, sudden extreme weakness. When your body suddenly hits a wall, we all feel tired from time to time. But what if, out of nowhere, you feel an overwhelming, crushing exhaustion, like your body just gave up on you? Not just regular fatigue, but a sudden, unexplained weakness that makes even simple tasks feel impossible? This isn't just being out of shape or overworked. This could be your heart struggling to pump blood efficiently, depriving your muscles and organs of oxygen. And here's the terrifying reality. Many people dismiss this as dehydration or stress, when in reality, it could be a silent heart attack in progress. Unlike normal fatigue, this weakness doesn't go away with rest. It can hit suddenly, making daily activities like climbing stairs, lifting objects, or even standing up feel unusually difficult. Some people describe it as if their body is shutting down without explanation. Here's what to watch for. If this exhaustion is paired with dizziness, nausea, shortness of breath, or chest discomfort, call emergency services immediately. This could be an active heart attack. If you've been feeling progressively weaker for no obvious reason, don't ignore it. It could indicate heart failure, where the heart gradually loses its ability to pump efficiently. Women, in particular, often experience extreme fatigue as a primary warning sign of heart disease, rather than chest pain. So what can you do? Don't dismiss sudden weakness. If something feels off, trust your instincts. Schedule a heart checkup if you've been experiencing unexplained exhaustion. Make lifestyle changes now to support heart function. Nutrition, movement, and stress management all play a role. The bottom line? If your body suddenly feels like it's running on empty, don't wait. Listen to your body because it could be warning you of something far more serious. Now, let's talk about symptom number 5, one that could appear on your skin long before it affects your heart. 5. Skin rashes and unusual spots. When your skin reveals the hidden danger in your heart. When we think about heart disease, we rarely think about our skin. But what if I told you that chronic rashes, red patches, or unusual skin spots could be your body's way of warning you about heart trouble? It all comes down to inflammation, a silent, destructive force that plays a key role in both skin disorders and heart disease. Conditions like psoriasis and eczema are not just skin deep. Studies show that people with psoriasis have a much higher risk of heart attacks and strokes. Why? Because their bodies remain in a chronic state of inflammation, which doesn't just affect the skin, it weakens arteries and promotes dangerous plaque buildup. Here's what to watch for. Persistent rashes, red patches, or scaly skin that don't seem to improve with treatment. Unusual spots or changes in skin texture that appear without a clear cause. A history of inflammatory conditions like psoriasis or eczema, especially if they've worsened over time. Most people see these as just skin conditions, but they could be a clue that inflammation is damaging your cardiovascular system as well. So, what should you do? If you've been dealing with unexplained rashes, see both a dermatologist and a cardiologist. Skin issues might be the tip of the iceberg. Manage inflammation through lifestyle changes. Anti-inflammatory foods, stress reduction, and proper medical care can all help. Don't just treat the surface. Understand what's happening inside your body. Your skin could be telling you a bigger story than you think, and if you ignore it, your heart could pay the price. Now, let's move on to symptom number 6, one that feels like an upset stomach, but could be much more dangerous. Unexplained. When your stomach sends a heartfelt warning. We've all experienced an upset stomach at some point, maybe from something we ate, stress, or a minor illness. But what if that persistent nausea, bloating, or stomach pain isn't coming from your stomach at all? Believe it or not, your digestive system and your heart are closely connected. When your heart struggles to pump blood efficiently, it can reduce oxygen supply to your digestive organs, causing symptoms that mimic acid reflux, indigestion, or even food poisoning. And here's the surprising fact. Many people, especially women, experience nausea as one of the first signs of a heart attack. Because it doesn't always come with chest pain, it's often dismissed as something minor until it's too late. Here's what to watch for. Nausea that feels different from usual, especially if it comes with dizziness, sweating, or an unexplained sense of unease. A feeling of indigestion that lingers, even if you haven't eaten anything unusual. Abdominal discomfort paired with pain or tightness in the chest, back, or jaw. Most people would never link stomach discomfort to heart problems. But if you're feeling unwell, and something about it feels off, don't ignore it. So, what should you do? Listen to your body, especially if nausea appears alongside other unusual symptoms. Pay extra attention if you're at higher risk for heart disease. If nausea is persistent, unexplained, or comes with additional warning signs, seek medical help immediately. Your stomach may not be the problem. Your heart might be the real culprit. Now let's move on to symptom 7, one that often gets mistaken for a harmless cold, but could signal a heart in crisis. Symptom number 7, persistent cough and hoarseness. The cough that won't quit and what it might really mean. A lingering cough, it's easy to blame it on allergies, a cold, or even acid reflux. But what if I told you that your cough could be a warning sign that your heart is in trouble? Here's what most people don't realize. When the heart isn't pumping efficiently, fluid can start to build up in the lungs. This can lead to a persistent, unexplained cough that just won't go away. In some cases, it may even get worse at night or when lying down. Here's what to watch for. A dry, persistent cough that lingers without an obvious cause. A cough that worsens when you lie flat. This could indicate fluid buildup from congestive heart failure. Coughing up white or pink mucus. This could be a sign of fluid leakage from the lungs. Hoarseness or a raspy voice that lasts longer than usual. Many people dismiss these symptoms as minor, but when the heart is struggling, the lungs often suffer first. So, what should you do? Pay attention to a cough that won't go away, especially if you also experience swelling, fatigue, or shortness of breath. If your cough worsens at night or when lying down, see a doctor. This could be a sign of fluid retention due to heart failure. Don't assume it's just allergies. If it's persistent and unexplained, get your heart checked. Not every cough is just a cough. Your heart might be trying to tell you something. Now let's move on to symptom number 8, one that can happen in an instant and put your life at risk. Symptom number 8, fainting and dizziness. When your brain loses power and your heart might be to blame. Fainting, it happens. Maybe you stood up too fast, skipped a meal, or were just dehydrated. But what if your dizziness wasn't just a fluke, but a serious warning sign from your heart? Your brain relies on a steady flow of oxygen-rich blood to function. If your heart isn't pumping efficiently, blood flow to the brain can suddenly drop, causing dizziness, lightheadedness, or even unexplained fainting, also known as syncope. Here's what to watch for. Fainting that happens suddenly, without warning. Dizziness that occurs when standing up or during physical activity. Feeling lightheaded, as if you're about to pass out, even when sitting. Fainting episodes that come with chest discomfort, palpitations, or shortness of breath. Most people assume that fainting is no big deal, but when it's linked to your heart, it could indicate serious conditions like arrhythmias, irregular heartbeats, heart valve disease, or even an impending heart attack. So what should you do? If you faint repeatedly, especially during physical activity, don't ignore it. Get checked for heart-related issues. If dizziness or near fainting happens alongside chest pain or palpitations, seek immediate medical attention. Track your symptoms. If fainting becomes a pattern, your heart might be struggling more than you think. Fainting isn't just an inconvenience. It could be your body's way of warning you before a life-threatening event. Now let's move on to symptom number 9, one that often gets dismissed, but could be one of the earliest indicators of heart trouble. When your body sounds the alarm. We all sweat. It's normal. Whether it's from a workout, a hot day, or even nerves before a big event, sweating is your body's way of keeping cool. But what if you suddenly break out in a cold, clammy sweat for no clear reason? What if you're sitting still, watching TV or lying in bed, and your body starts sweating uncontrollably? This could be one of the earliest and most overlooked signs of a heart attack. Why? When your heart is under extreme stress, like when it's struggling to pump blood efficiently, it triggers the body's fight or flight response, releasing stress hormones that cause sweating. This is especially dangerous when accompanied by chest pain, nausea, dizziness, or shortness of breath. Here's what to watch for. Sudden, unexplained sweating, especially if you're not exercising or overheating. Cold, clammy skin that comes with nausea, lightheadedness, or an impending sense of doom. Sweating that happens alongside chest discomfort, jaw pain, or difficulty breathing. Many people brush this off, assuming they're just anxious, coming down with something, or overheated. But in reality, cold sweats can be an early warning sign of a heart attack. So what should you do? If you break out in a sudden, unexplained sweat, especially with other symptoms, don't ignore it. Call emergency services if it happens with chest tightness, nausea, dizziness, or shortness of breath. Monitor your body's signals. Sweating can be your heart's way of sounding the alarm before a crisis hits. Your body knows when something is wrong. It's up to you to listen. Now, let's talk about the final symptom. One that could be draining your energy long before you realize your heart is in trouble. Symptom number 10. Unusual or prolonged anxiety. When your heart and mind are connected, we all experience anxiety at some point, maybe before a big presentation, during stressful moments, or when life throws unexpected challenges our way. But what if your anxiety feels different? What if it's sudden, overwhelming, and seems to appear out of nowhere, without any clear reason? This could be your heart's way of warning you before a crisis. Why? Your heart and nervous system are deeply connected. When your heart is struggling, whether from high blood pressure, poor circulation, or irregular rhythms, it can trigger anxiety-like symptoms, including a racing heart, dizziness, and shortness of breath. Many people mistake these heart-related symptoms for panic attacks, especially women, who are more likely to experience anxiety, nausea, and fatigue as early signs of a heart attack rather than classic chest pain. Here's what to watch for. Sudden, intense anxiety or a sense of doom without a clear cause. Heart palpitations, dizziness, or shortness of breath paired with unexplained panic. Anxiety episodes that feel different from past experiences, especially if they come with chest discomfort or sweating. The truth is, your heart can trigger panic-like symptoms long before a heart attack occurs. It's your body trying to warn you that something is wrong. So what should you do? Don't ignore unusual anxiety. If it feels different or is paired with physical symptoms, take it seriously. Monitor your body's signals, especially if you have risk factors for heart disease. If anxiety comes with chest tightness, shortness of breath, or nausea, seek immediate medical attention. Sometimes what feels like stress is actually your heart sending an urgent distress signal. Now let's talk about the symptom number 11, one that slowly drains your energy and could be your heart's way of telling you it's in trouble. Symptom number 11, decreased tolerance for exercise. When everyday activities feel exhausting, do you find yourself getting winded more easily than before? Maybe climbing stairs leaves you unusually short of breath, or a simple walk feels more exhausting than it used to. Most people assume they're just out of shape or getting older. But what if your heart is quietly struggling to keep up? A sudden drop in stamina could be one of the earliest warning signs of heart disease. Why? Your heart is responsible for pumping oxygen-rich blood to your muscles. If it's not working efficiently, whether due to blocked arteries, heart failure, or other cardiovascular conditions, your body will struggle to get the oxygen it needs, leaving you feeling weak, dizzy, or completely drained. Many people ignore this warning sign, thinking they just need to exercise more. But pushing through the exhaustion won't fix a heart problem. It could make it worse. Here's what to watch for. Feeling winded after minor activities that never used to tire you out. Shortness of breath, dizziness, or an unusual sense of weakness during simple movements. Needing to stop and catch your breath more often, even during routine tasks. Most people think heart problems start with pain, but often they start with fatigue. So what should you do? Listen to your body. If you're losing stamina, it's not just aging or being out of shape. If breathlessness is persistent or comes with chest tightness, don't push through. Get checked. Early detection is key. Catching heart disease before it escalates can save your life. If everyday activities are suddenly leaving you exhausted, don't ignore it. Your heart might be struggling. Now, let's talk about what you can do to protect your heart and avoid these warning signs turning into a life-threatening event. Your heart's final warning, will you listen? Your heart never stops working, day and night, beat after beat, it keeps you alive. But the question is, are you listening when it tells you something is wrong? Most heart attack warning signs don't start with a dramatic collapse or a gripping chest pain. They start quietly, subtly, in ways you'd never expect. And the biggest mistake people make, ignoring them. By the time the classic symptoms appear, the damage may already be severe. But now, you know what to look for. You have the power to act before disaster strikes. Take action today. If you've noticed any of these symptoms, don't ignore them. Talk to your doctor. Prioritize your heart health. Small changes like improving your diet, exercising regularly, quitting smoking, and managing stress can dramatically reduce your risk. If this video helped you, it could save someone else's life too. Share this with your loved ones because heart disease doesn't discriminate, and awareness is the first step toward prevention. Stay informed, stay heart healthy, and remember, your life depends on it.